I feel like we're like on the Weather Channel, like going live in 5, 4. Okay. All right. Thank you, everyone. And thank you for coming together rather quickly for the meeting. We wanted to try to touch base before legislative session starts and to go over some topics that were carryover from the last meeting. So thank you, Miranda, for getting everybody notified and doing this so quickly. So I appreciate that. Everybody got the agenda and the minutes. If somebody would like to make a motion to approve the minutes or bring up there was any corrections, additions, that would be great. Anybody want to make a motion?
This is Daryl. I would move to approve. This is Daryl.
Thanks, Daryl. Nice to see you. Is there a second?
Second.
Thank you. All in favor say aye.
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 Any opposed? Great. All right, so we have just a couple topics for the agenda, primarily carried over from the last meeting. So one is talking about legislation for loan repayment for public health. And so Miranda was able to send out the Century Code where the State Health Council comes into play for the loan repayment, as well as other things that we're able to do. Because of the turnaround, one of the suggestions, I think, by Senator Roars was to possibly look at incorporating public health into an existing category, or working on this with the intent to figure out where things stand in 2 years. So I'm going to turn it over to, if you don't mind, Kristen, to discuss anything, and then Mark, as you were kind of leading the charge on this, if you guys have any comments on how we can proceed with this, or which direction to go.
Yeah, so I'll start with the fact that my suggestion for including it in another was, I have a hard time seeing it passing in any other fashion. I'm not sure I'm 100% on board with the idea in general, but I also, if we're going to do it, I want to make sure it can be as successful as it can be. So I don't know if you want me actually leading the conversation. Probably let Mark lead the conversation, and then I can give some input.
Sure, thank you. I don't know what there is to update, but there's a couple of thoughts, I guess. So Kelly Nagel had included in her governor's policy public health workforce recommendation to incorporate this into the governor's proposal. And I don't know how it was perceived at the administrative desk. I'm not sure, and Kelly might be able to respond to that. The second thing I'd like to point out is that this is clearly a high priority nationally. So currently for the House is House Bill 3297 called the Public Health Workforce Loan Repayment Program, sponsored by Representative, get my name straight here, Crow from Colorado and Burgess from Texas. And then also Senate Bill 3506 called the Strengthening the Public Health Workforce Act, sponsored by our neighbor, Senator Tina Smith, and then also Susan Collins from Maine. So both of these bills have strong bipartisan support. And so these are now, being put forward. And so, essentially this is a federal priority. And I think it shows how important this is for reinforcing public health, both in terms of cracks in the public health infrastructure that have been revealed because of COVID, and then also just longstanding challenges to attract talent into public health because of debt, and then also low-paying jobs, and typically working in hardship, workforce locations. So those are two things being put forward to the governor here in North Dakota. And then also nationally, there's two bills that are in process that are going to take a lot of work, obviously still. And I hope that we, would understand the importance of our public health infrastructure. It is the social contract that we have made with our people by saying that the government will support this priority to keep us safe, to keep our water free of lead, to keep us protected during pandemics, to vaccinate children, and all other myriad services that we want to ensure. And I think currently the workforce shortage issue and the salaries, frankly, to be able to repay student loans are really substantial. So those are a couple of detailed comments and then also just a personal reflection. The idea of incorporating into the existing student loan repayment program, 40, I guess it's in Century Code 4312.3. I would be fine with, putting that idea forward and, consider the possibility of that. If it means the ability to get it moving forward. So I don't feel the need to have a separate program. However, it would need to specify differences because what it means to be a licensed physician in North Dakota is a very explicit and a very narrow designation. And what it means to be a public health professional is much broader. And obviously a lot of different persons serve in local public health. And I think, so we would just have to find out a way to designate, what individuals would be eligible to benefit from such a program. And I mean, I have my thoughts and I'm sure others have their thoughts, but that would be one of the areas that would have to be clarified. So those are the comments I'd like to offer to the group and, beg you all to consider. I do know that I've spent a lot of time talking with local public health in the last few years. They're very demoralized. They're discouraged at how things have played out. They need encouragement. They need financial support. They need to feel connected to our state and connected to our upper level administration. They need to feel connected to our state health officer. And so I think there's, this as part of the State Health Council, in some ways just representing the people of our state. In this case, I'm representing our local public health workforce in trying to communicate a desperate need, and they're the last people on earth to ever ask for anything. And so those are some of the rationale. Beyond some of the facts, those are some of the other rationale in terms of ensuring that our public health workforce is attractive to high quality candidates, can retain them for the long haul, and can frankly to live up to the kind of performance that people like Sherry have done for the last 30 years. I mean, finding someone to replace these individuals is a challenge, and I think this would be a solution, a significant contributor to solving that. That's all I'll share for now.
Kelly, do you have anything to add from what was put in? Oh, you just raised your hand. Kelly.
Yeah, nothing to add as far as that, but I was tasked with collecting data, the workforce data at the state level and the local public health level. And just to let you know that data has not been collected yet. We are working on a survey instrument, and then I just wanted to kind of reference the challenges as we wanted to make sure that we had a definition so it was equitable at both the state and local level when we were collecting the data, as far as it being population-based activities and public health science or public health-based activities. And that would be the difference between the healthcare professional program and the public health loan repayment program, is that it needs to be population-based. And so it took us some time working with the HR team at the state level to define that so they could collect the right data from the right staff positions. And then we have written that into a local public health survey that will be going out here shortly. So just wanted to let you know that's where we're at and where we're going.
Thank you, Kelly.
So Kristen, as being a legislator, what is your opinion or suggestion how we would move this ball forward one way or another, or work on it with the aim in 2 years, we have more time to go forward? What is your thoughts?
I think I would encourage you to try and introduce it. If this is something that we decide as a group we want to move forward with, I would encourage you to introduce it this year, but have the expectation that it will likely not pass on its first try. Many things have to go up the flagpole multiple times before they kind of catch. I think if you wait till next time, then you're really waiting, 6 years. And so I think if we can introduce something, but I think the question will be, are we creating, yes, it's within that section of code, but are we creating another program, like where the only people who are eligible for X amount of money are the people in this category? Or are we finding a program that already exists and has 3 or 4 different jobs in it, and this becomes the 5th, and then we ask for some additional money? My gut feel is that would be more successful, because they would see that there's not a new administration required, any administrative work additional required. It would just be, you'd have a larger pool of applicants, and then hopefully a larger pool of money. And sometimes what you'd have to do is get the category added to the applicants, and then the money, hopefully the next time, you got to play with that a little bit. I know, Dirk and Dr. Wiebe have felt this over the course of the last, what are we at, 2.5, almost 3 years now. The friendliness of the legislature towards the public health realm is not at its highest point in history. I'm trying to be as politically correct as I can be on that. And so that's why I guess I have the hesitation when I said that, I'm not sure how I feel about it. I am a politician at the end of the day. And so for me, I look at stuff and say, okay, what is the likelihood of its success? But I think if we go into it with the expectation that, it may not happen on the first round, I think that might be at least then you're not let down as easily. And if you succeed, you're pleasantly surprised. So.
Thank you. That I think makes the most sense to me as well. For a couple of reasons. Besides us, the image of public health right now, we're going to have a whole lot of new legislators. And so the overall view I'm hearing is try not to bring in a whole bunch of new stuff to them all at once, because it's probably going to not go very far, just because there's so many new people going to come on board.
Yeah, I think that's an interesting dynamic, just to see how that does play out. Is it that way, or is it the opposite because they're willing to look at new ideas? So I think it's going to be an interesting dynamic to watch.
Yeah, definitely will be. So because I don't know, yes, Mark, I was just going to say, I don't know how to proceed with this. So it would be good to have directions, but I'll turn it back to you, Mark.
Well, yeah, I was going to say, I think there's an alternative consideration, which is with a lot of turnover, everybody's going to be rushing to them. And I don't think waiting is in our best interest, because they're going to have 100 interests across the state coming to their, to their attention. And, I'm not saying it's a fight to get the front of the line at Best Buy on Black Friday morning at 4:00, but it is. And so I think that, Kristen, thank you for your comment. I think how to, things to do to reestablish the public's trust in public health, because I think we know I'm a scientist, and we all reevaluate what we've done. And I think there's many lessons to be learned by public health over the last pandemic. I think communicating with the public, bringing stakeholders to the table for open conversations earlier, those are things that we learned we probably should have done better. But I think we also have to acknowledge that a substantial part of the perception of public health in the public was based on misinformation. It was based on heavily funded misinformation that was designed to essentially threaten the legitimacy of the government, and then also to undermine the right of public health as the government's, arm and servant, to have anything to say about their decisions or their movements. And so I think we can't deny the reality of misinformation. And I think as scientists and as fact-driven, evidence-based persons, we have to somehow be very careful in how we try and reestablish our trust. Because on the one hand, we need to do so by acknowledging that we can do better. And any science-based field is always in the process of doing better. There's nothing called perfect. There's nothing absolute. Everything's just less incorrect with every move, step that you move forward. But secondly, we also need to do so in a way that can counter misinformation with truthfulness. And so I think, how can we, I guess my question is, how can we, as influential persons, as a state health council, maybe as a state health council, we need to make a statement to, I don't know, that would be taking sides, I guess, but somebody needs to stand up and start to publicly defend and thank public health for what they have done over the last 3 years. And, I don't know who that would be and how that would happen, but I think sometimes meeting misinformation and animosity by kind of steering clear of the direct basis of that animosity, and instead just recognizing the positive, creating a positive rhetoric, a positive argument. Thank you for this. Thank you for that. If the notion of vaccines is going to cause people to be really upset, then we don't thank them for administering vaccines. We thank public health for what they have done to serve tirelessly, to put aside their daily tasks, to take on responsibilities for which they were not originally assigned or trained, but to do so. I don't know. I think this needs to happen across, our state, and I don't know what role the Health Council has in that. But I don't want to digress from our point on the table, which is how do we move forward with a public health loan repayment program. But I would welcome anyone's thoughts on that rabbit trail regarding, is there any responsibility the State Health Council has to help rebuild some of the trust in our people toward public health or not? And I'll allow that rabbit trail to go for a second if anyone wants to respond, but I'm also happy to bring it back to the issue on the table because I don't want to spend 2 hours just down rabbit trails. So I welcome any feedback on the rabbit trail at this point in terms of, do we have any responsibility in terms of trying to reestablish the trust? Because I know we have responsibility for holding public hearings. We have responsibility for supporting the public to do pilot projects. The State Health Council, as it was formed, has a significant responsibility to represent the interests of the state, the people of the state. And I think right now, one of those would be a healthy and a balanced reappraisal of the role of public health in a way that our state would understand it and appreciate those persons. Any comments on that rabbit trail? Like I said, I know it's maybe not the issue on the table, but doesn't the State Health Council have any responsibility in that issue?
Gerald raised his hand.
Oh, okay.
Mark, I certainly agree with what you're saying, that maybe we do have a role in supporting the work of public health. And as I look on screen, I see Dirk. Dirk was picked on occasion when the health department was doing some work, as was Dr. Wiebe. I can go to Tim Wiedrich, on and on. We can go to a variety of folks who were criticized by some with the work that was being done during this pandemic. But certainly public health was at the forefront of a lot of this as well, too. So to that topic that you brought up, Mark, I would certainly agree and support that maybe it is or maybe it isn't the role of the Health Council, but certainly we all, I think, feel passionately about that. Now, when it comes to expanding the loan repayment program for public health potentially, I know we're talking about timing, but how could that be done right now most efficiently and effectively going into the session? And Kristen, I guess I'm looking to you. What is the best way if we would want to move this forward?
I guess I would have to, the first question I would need to ask, and I don't know if it's Dr. Wiebe, if it's Dirk, or if it's Kelly, did this make the governor's proposal?
Yeah, and Kristen, I would say that that's all still being evaluated. I think workforce is a priority for the governor, which I think he's already talked about, but as you have echoed, has a lot of competing priorities in terms of workforce. And so where does that priority sit? And so we don't have a firm answer on that. Okay. So I would say that that's still being evaluated. I don't know if Dr.
So that's the hard part is if it's going to be in there, I think that's a good spot for it. If it doesn't make the final cut, then I think, we need to determine what do we want it to look like and then find who's going to be the prime sponsor from a legislative perspective. So that's kind of the two paths, for lack of a better term.
So Dr. Wiebe, you had your hand up, and I think unless you want to have another meeting really soon, I think we need to at least discuss how that would work if this first part doesn't work.
Yeah, and in fact, Kristen stole some of my words, which is, who would be the sponsor to do that? There are kind of like, I think, three aspects to this issue. Who would be the sponsor if we decided, or if the decision is to go through a legislative bill? And then how many spots we are thinking of, and then how much money would that translate to? And I kind of like, think there is a point to what Senator Roars mentioned, that, it might take multiple attempts before a bill is adopted and passed. And it might be the best idea to act sooner than later. And to that end, it is very important to decide on the amount of money. So then the amount of money itself is not the reason why it doesn't pass. We do not want to shoot ourselves in the foot.
Thank you. So I think, and Daryl, you'd raise your hand real quick, so I'll wait to think until Daryl talks.
Well, of the funds that are available for loan repayment, I can't remember, were all of the funds spent, or were there still funds available so that maybe new funding isn't an issue? I just don't recall.
Kelly, do you have a
Yeah, I was going to say Kelly or Kaylee.
So you're referring to the healthcare professional loan repayment program? Yes.
Or kind of any, do we have any category of loan repayment that isn't using their allotment?
No, all those funds, the slots are distributed and awarded. And then we even have additional funding through the federal loan repayment program, which is fully utilized as well. So
that at least gives us the baseline, that it's not like there's, a category that's currently underutilized.
How much do you kind of allocate in a ballpark figure, a person, but that's not necessarily a physician, or dentist, they probably make more money. But how much do you give like a nurse? Because that would be pretty comparable. So we would have a ballpark figure for funding. And I would suggest at least one or two to start with. I mean, that, anything would be better than nothing. So go ahead. I'm sorry to interrupt.
well, Kaylee, definitely jump in, but if I remember right, for the behavioral health nurses, it's 20,000 with a 2,000 match. So the 22,000.
And is that over the course of like 5 years, or is that
5 years.
That's not a one-time hit? Okay, so.
And I think that would be about the same. I think you could utilize that amount of money pretty consistently. Obviously, people that have their masters and doctorates, theoretically would make more money, but in public health, that's not necessarily across the board. But I think that would be a good starting place, that 20,000. And I would suggest two, but as far as their sponsor goes, Christian, you might know more, but I do know Judy Lee is very supportive of local public health. So she might be one person, that you might know others, Kristen. And
yeah, I was trying to look and see if there was anybody that jumped out at me from the House, and kind of the top two that I thought about from the House are not returning. So I think we have some opportunity also to, if there's someone new coming in. I know Sean Cleary is coming in the Senate if things happen the way I hope they happen. And he has a passion for human services. And so, he used to be the governor's human services person. So he has a good solid knowledge. So I think we have some opportunities. And so I don't know that we need to specify, like if we say, okay, yep, we want to draft a bill and find a sponsor. I don't know that we specifically have to specify who that is going to be, just that this is the process we want to follow. But I think there's a couple things. So do we want to, like, is there a program that it makes sense merging this into? And if so, which one? And if not, then it'll have to be a standalone program. And so then it would be drafted as its own kind of category. Obviously, we can just mimic a different program in the administration piece, but I think that's one of the first steps. But I see Carrie has her hand up as well.
That's Carrie, and then Mark.
Yeah, good morning. I am just wondering if the best route, to get it to pass would be to add it to the already what we have with physicians, nurses, and everything. And at this point, pool that in with the money that we have and offer one position, but not ask for money at this time and ask for money at a later time. I know we may have to reshuffle where money is allocated, but I don't know if this is an easier way to get public health into this loan repayment.
I know Mark's next, but can I just respond to that very quickly? My suggestion would actually be to ask for the money with the realization that likely it's going to get amended out. Kind of like when you ask for more than what you want, hoping that you'll get halfway there. So.
Thank you for that comment. Yeah, so the section in Century Code, they just lists out each of the categories. So it wouldn't be hard to just add another category in there. I think it'll be a little more complicated category based on, my prior. However, behavioral health professionals are also not one explicit accreditation or one explicit licensure. So I think we do have, some precedent there. And I would also be concerned that we not allocate additional funding, because what that means is that means we're taking money away from other, if we're adding in this category, but saying we only need for 2 persons, then that means that $40,000 is going to be deducted from what's available to the other existing categories, which probably wouldn't sit well with those, especially as we've just heard, those dollars have all been used. So it isn't as if any of them are unable to find vets and nurses and addiction counselors. So thank you for that, Kristen, as a legislator. I appreciate your support of that. So I'd like to consider that we propose adding it in as another item, under section 3.306, and that we ask for $40,000 to make 2 slots available in the next, right out of the gate.
So is that your official motion?
No.
You want to make an official motion?
I mean, yes, I will. So I'll make a motion that we add the public health professional category into the existing student loan repayment program 4312.3 in Century Code, and that we add public health professional as a category, and that we ask for funding for 2 persons, and that we ask for $20,000 a year per person, which is comparable to what's being offered for behavioral health counseling, I think. What did somebody say? What did you share? You had a category. Which one was it?
It was behavioral health. Yeah, that was the one brought up. That's pretty comparable.
So that we would kind of anchor it to that category. That's my motion.
We'll do a second and then discussion. Is there anybody that wants to second that?
I'll second it.
Thank you, Carrie. All right, any discussion on this? I think the only thing I would say is that in lieu of it passing with the governor or something like that, then this would be the next step. I don't know how we word that in there, but I think that would be the only thing to do this in lieu of if the governor doesn't pass it or whatever that is. Does that make sense?
So are you saying that if the governor includes it in his final budget proposal, then this would be unnecessary?
That's the way I was understanding it. Dirk, you have your hand up.
Well, I still think you'd need to do the legislative, like the Century Code language, the policy part would have to still be changed.
Okay.
So,
Then-
Dirk, can you help me? I'm just, because you said 4312.3. Is that where you said it was? I'm struggling to find.
Yeah, so you mean in terms of the category?
Okay, yeah, okay. So it's the student loan repayment program. So it would be, I'm just trying to find the language because I can get legislative council working on drafting it. So when
You'll notice, Kristen, under 4312.306, so number 1 lists the categories. And you'll notice item E is a 6-point elaboration on what is meant by a behavioral health professional. And so I think we're in a good place in terms of, acknowledging that a public health professional also has maybe 6 designations. And so it gives us that wiggle room to say we're not trying to compete with the notion of a physician, which we know as having a very explicit definition and licensure. So, yeah, that's where I was looking at.
So
Thank
we need to figure out how to define a public health professional. Even just a simple one that for that. And
So
then,
some categories are like environmental health practitioner, nursing or nurses.
yeah, I think the hard part is, oh no, they didn't define all of those in here. So we may not need to define it. So we would just add insert a sub E. So for a public health professional, 1, the loan repayment may not exceed, the matching funds must equal. And do we think that because most public health professionals work for a local public health, not a private thing, that the match will be a problem?
And that would be an issue, but I would like, and I didn't say it in my motion, but my motion would be that they are government public health employees. Because in fact, right now, the workforce challenge is the nonprofit and the for-profit sector are gobbling up all of our MPH graduates because they pay better. So I would be inclined to put it to prioritize local or state. I'm not opposed to providing state, but I think local public health is the need. If we can find a way to get somebody to move out to Dickinson and move out to Williston and to stay there long enough to meet the terms of this, I mean, that would be gold, wouldn't it, Sherry?
Absolutely.
Yeah. So
My question though is, can Dickinson do a match?
I'm sure they would if it's like $2,000. Yeah.
that's pretty helpful.
I just want to make sure.
20,000.
Oh, yes, 20,000. Sorry.
But it's 10% of that. So you're right, it is 2,000.
Yeah.
Okay. Yeah.
Okay. So, and thank you, Dirk, for clarifying that. Dr. Wiebe?
Yeah, just kind of like one thing that is more specific to public health field is that many times a public health professional could be from various background when it comes to training and education. And so one of the ways maybe to kind of like maybe specify that it has to be of a public health background is some of the language, Mark, that you shared in the proposed resolution, that maybe that they have an MPH or they have a certificate in public health. So then it is more specific to public health rather than a nurse or other profession that kind of like ended up in public health. So just maybe
I would put some kind of college, and I don't know if I'd just say master's, because bachelor's for, I'm thinking environmental health, which is a very gapping program right now too. And you only have to have a bachelor's for that one. But I think you absolutely have to have some kind of college education or something to fit the criteria to actually pay back loans. Yes, Kelly.
Sherry, and I don't know if you want to be that restrictive to the MPH, because that's what we were hearing from local public health too, but how we're defining it when we collect the data is we are saying public population-based activities, public health sciences, non-direct care.
Can you read that again?
So those
population-based. Can you read that again quick?
Kelly, insert it in the chat. Put it in the chat so that Kristen can copy and paste.
We'll do that.
Thank you.
And Carrie, you have your hand up? if you're talking, we don't hear you.
I didn't mean to put my hand up. Sorry.
Oh, that's okay.
There it was.
All right, so we have a motion and a second on the table. Any other discussion? Any other discussion? All right, Miranda, would you do a roll call vote, please?
Adams,
Yes.
Daryl Birch,
Yes.
Mary Gumke, Mary, can you say that one more time? Dr. Ranum,
Yes.
Kristen Roars,
Yes.
and Dr. Strand.
Yes.
That's so exciting.
Thank you all for, this means a lot to me. I'm new to this council, and to see you guys take this on, candid conversation, fully aware of challenges or headwinds, but to see the concern for our state, for our people, and for our local public health persons as a part of our health council, it means a lot. So thank you. And I want to offer, like Kristen, I don't know if you would be taking the lead in terms of how to write up write up something to bring to some other legislators. I would be happy to help or happy to meet with persons. So thank you for helping with that.
Yeah, so I will send in the request for a bill draft to Legislative Council that will state, we want to add a new sub E in 4312.306 that will say for a public health professional, the loan repayment may not exceed, the same language as before. For the purposes of this section, a public health professional means an individual who practices in the public health field and is bachelor's, master's, or doctorally prepared, provides population-based activities and in non-direct care services, and to provide an allocation of $40,000. So we'll get that, and then once we get it back, then I think we don't need to do anything official amongst the group, but we can kind of shop for a sponsor at that point in time once we have the language.
That is just super impressive that you did that in that short period of time.
I know.
I'm like my mouth open.
It's called copy and paste.
Well, that's impressive. Thank you so
My
much.
head is spinning. Kristen, can I take you under contract as my legislative counselor mentor to figure out how this stuff works?
I'm fairly certain you can't pay me because I'm already being paid to do the job, but that's called constituent services. So we can work out something.
Thank you.
Awesome. Thank you so much. So now we're going to move to number 4 as opposed to number 3. And then we'll come back to number 3 because I think we're kind of on a roll here. And so Miranda sent out the from Allison, the memorandum just recently. You should have it in your emails about some of the categories that this group is in charge of. I was surprised reading through it that it didn't really have anything from before. So I don't know if that was already taken out where administrative rule, because I didn't see that in there, but I'm going to turn it back to you, Kristen. And I know you've talked a little bit about what are our next steps as a health council. Do we want to put in additional wording as to how our role is, et cetera? So thank you.
So I had sent thank you, Sherry, for sending that to me. I sent a request out to Senator Lee, Senator Anderson, Senator Hogan, Representative Wise, Representative Rohr, Senator Pullman, Senator Dever, Representative Nelson, Representative Ruby, Representative Craig, Representative Mitzcog, Representative Porter, Representative Dobrovich, Dick Anderson, Representative Pollard, and Senator Wardner, just to try and get a really broad, anybody who used to be on the Human Services Committee or run the Human Services budget or majority leader and had kind of that historical knowledge. I didn't get a ton of feedback back. One just said historically they've had a lot of policy and administrative responsibilities. You might want to have legislative council do a legislative history of it. I didn't know that we really needed the full history, because I think we do have some knowledge of that. Senator Anderson did write a little bit longer saying, he served for 23 years on the State Health Council. During the time, their work was very serious business, certificate of need, final arbiter of complaints about licensing, directional policy at the health department, and the actual selection of those who receive state loan assistance. Health officer and the governor took the council seriously. The council needed the support of the 4 governors preceding our current one as he appoints the council. We have always received that support. However, in recent times, the council has not received much deference. I'm going to take a little editorializing out here. So one of the challenges was then there was legislation that was passed that kind of contained a shift to an advisory role for this group, and the move to get the input from various professional groups on the loan repayment decisions has made the role of the Health Council somewhat less necessary or less important. The groups do a great job at it, and there's seldom much need to second guess their choices. I would agree with that statement. It's very rare that we have a different outcome than what was brought to us. Sometimes we would rank number 1 as number 2, but still they both qualify, that kind of thing. And then, Senator Anders said, in short, I think that the council should be eliminated and that the loan repayment decisions are left to those support groups, perhaps a staff person, to be sure the rules, laws, rules, and federal guidelines are followed. So that is really the only feedback that I got. I have to say, I've been on this since, Daryl, when did we come on? 6 years ago? I think about that, somewhere around that, right? Because it was before I was in the legislature. Even at the beginning, I kind of struggled to feel our purpose. And then as time has gone on, it has gotten less and less consequential. And so I struggle to find what that new way forward could look like. I'm not opposed to us finding a new way forward, but if we don't come up with something other than just being the rubber stamp on loan repayment, then I have a hard time continuing to participate in the group, because it feels like we're meeting just to meet and not because we're actually accomplishing a lot of work.
Thank you. I think that is at least the mindset in others on this group. It would be sad just to say we're going to be done, but I agree. If all we're doing is blessing loans, because that's the way I read all this, is like, okay. I guess this would be a question for Dirk and Dr. Wiebe. If this group doesn't exist anymore in the capacity that it is, who would do some of the things that, like the loan repayment, the hearings, and that kind of stuff? How would that be directed in a different way?
Maybe I'll jump in quick, Dr. Wiebe, and you can course correct me if that's the way we want to go. I think, as Senator Anderson said, we would bring the running of the programs would probably happen with the programs themselves. So Kaylee and Kelly would probably do the evaluation work, and then if there was an appeal process, it would be like any other programs that we'd have. We'd have to go through the normal appeal processes that are established in state law to follow those activities. So, we would sort of fall back on the other laws in place and standards and kind of just mirror what we do with all our other programs.
What are others on the Health Council? What are your thoughts? And if you don't want to get rid of the group, what are your thoughts to put in additional wording to make us more valuable? And I see, Daryl, do have your hand up.
I think Dr. Wiebe was going to make a comment though, right? And he deferred to Dirk here. So would that be appropriate first?
Sure. Yeah, absolutely. And
Thanks, Mark.
So I recognize kind of the sentiment that, anyone, including the State Health Council, do not just want to meet for the sake of meeting. We want always to be productive, to make an impact, and to contribute to the betterment of public health and our citizens. But also there might be other ways. So if the sentiment or the thought is maybe not have the State Health Council in this particular structure, and as maybe Senator Anderson or others might think that maybe it's not serving as it used to serve in the past, then we might think of a different way. So even if State Health Council were to be disbanded or eliminated, there is still an opportunity to seek the advice and the input of all partners, whether it's legislators, whether it is university, local public health, NDMA, many other businesses. And we can still include this input and feedback and contributions to our plans or our public health strategy and vision. But in a way, maybe that does not really is dictated in the Century Code, or does not require you have to meet that many times and rubber stamp loan repayment program. So the loan repayment program, as Dirk mentioned, it might be more administrative, could be brought back to the Division of Public Health, but all other aspects of advice, consultations, feedback, input, that we can transition, that we can think of a way to transition. So then we can still reach out to, Sherry and Mark and Senator Roars and Dr. Ranum and businesses, Mary and others, and seek their input as we are implementing this public health vision and strategy at a state level. So one point that I'm trying to make here is that even if the sentiment and the decision is to disband and eliminate the State Health Council, we will still have another mechanism to seek that advice and collect that input from all of you.
Thank you, Dr. Wiebe. We'll go to Gerald and then back to Mark.
I think Dr. Wiebe touched on some of the things that I was going to bring up. There's work that I'm assuming will be done to help make North Dakota the healthiest state in the country. And certainly having consumer or advisory group input from a group like the Health Council certainly would provide value, I think, in this work and in this initiative. The other thing that I think where there's a gap is each respective area across the state does a community health needs assessment. The Center for Rural Health has that information available. They collectively put it together, and you can really get a sense of what the health needs are across the state of North Dakota. And then it seems like that's where it sits. That's nice. There's those needs. How is each area addressing them? But is there a role that the Health Council could play along with the Health Department to try to work towards some of those things and to be a convener of some of that, and or providing additional input on some of the ways to bring that to the forefront for the general public? I know those are just some additional thoughts that come to mind when I see and hear the word State Health Council. It's not the state loan rubber stamp company. It's the other thing. So just my thought.
Yeah, you are on point, Darrell. And one thing that I would like to that will allow us to be more flexible and more inclusive, because to be on the State Health Council, it requires an application and a governor appointment and so on. So and it is restrictive because now we have 9 members and we cannot just add or subtract members. But take that advisory role outside of State Health Council, then we will have more flexibility in being more inclusive to our stakeholders and the people that we want to be part of, providing the input and the resources and the advice. But that's one way of looking at this. And I see Dirk had his hand up also.
Well, I had my hand up to say essentially the same thing that you said. Is it, I think in the current structure, you wouldn't want just the health council to be part of those groups, right? Because when you're talking about community assessments and you're talking about kind of how do you get the state to where it wants to go, you're going to want a lot of different feedback from a lot of different individuals and populations. And so obviously all of you represent different areas. And I think we'd want you to represent those different areas on those advisory bodies as well. But it would have to be, in my head, at least broader than just this group to really be as effective as we want it to be.
Thank you, Mark.
The State Health Council seems to be, existing to represent the people, the health needs of the people, part of the thing regarding hearings and pilot projects is in Century Code. It's also clear that we're meant to be a support to the Department of Health and the DHHS now and the state health officer. And in fact, the document that we were sent excluded the first page and a half. And I don't know if sharing my screen would help or if I should just read it, but the first page talks about the council may direct the state health officer to do or cause to be done any or all of the things which may be required in the proper performance of the various duties placed upon the Department of Health and Human Services. So there's a strong statement regarding the intimate relationship between the health council and the state health officer. So we need to establish, either we ignore that or we have to establish a mechanism by which that happens. Do we control or dictate the state health officer? Of course not. But can we be an asset and a reliable support? Because I think, although I agree with Dirk that definitely the move nowadays is more community-based and population-based groups to represent the interests of decision makers. However, if those are arbitrary, then the risk is that then the Department of Health or the governor would pick various advisory groups based on other criteria than Century Code established persons whom you can find, who they are, that they have no conflict of interest, and that they have an obligation to participate. So I think I'm concerned that although, yes, we should seek lots of input from lots of community-based organizations, there's a risk that there's conflicts of interest and or that it's selecting friends, selecting the same stakeholders to be so-called advisors. And I think that's very risky. And the fact that we've been vetted, and I'm not saying that I'm any expert in any capacity, but I did apply to this at the invitation. I was vetted and I was selected, and I feel an obligation to do so. And the public can watch this meeting and know what we're talking about. There's no concern about behind closed doors talking about conversations. So I think the Century Code document that's important actually wasn't included in the report that we got from Allison, because it talks about established standard. In addition to our relationship with the state health officer, it talks about our obligation to establish standards and regulations which are found necessary for the maintenance of public health, including sanitation and disease control. Now, since our last meeting, I've connected with Dr. Wiebe and Allison to confirm what that means. And the answer is, well, nobody really knows what it means. So the word establish is meant to be in collaboration with the Department of Health and Human Services or with the legislature. But at a minimum, that's a pretty strong statement that we are meant to establish standards and regulations. So I don't think any of us feel the need to turn back time to reclaim authority that we may have had or perceived to have 20 years ago, because things change. But I would like to think of the Health Council from a new opportunities and a future perspective in terms of a role that's meaningful, that's substantive, that's non-bureaucracy, that's not, controlling or hand tying for the DHHS or for the state health officer, but which is substantive, public, open, and hopefully fair. Now, what that exactly means, I'm not completely sure, but I think we, like we've been suggesting here, we either wrap it up and say the purpose is no longer being asked of us, or we envision a more optimistic, future-looking, it's a new day and we have a role to play and let's define what it is. And the Century Code has told us two things: working with the health officer and establishing standards and regulations. In addition to all the other, you talked about, rubber stamping kinds of tasks, that's all there too. And I think that's all fine and good. But I don't think any of us want only the rubber stamping tasks if we also don't have the opportunity to contribute to helping our state reclaim ourselves which we were in 1999, as the healthiest state in the nation. So those are just my thoughts on what we might need to be, could become, or the opportunity before us. I also would be willing to close it down if it's not needed anymore, but I would be reluctant given that the state has it in century code, therefore it's someone's priority that something like this exists. Thank you.
And I think the other side of that, Mark, is that if you shut something down, it's a lot harder to restart it again. And so maybe we look at possibly adding the new changes or adding whatever, or reassessing in 2 years. And if something hasn't changed in this go round, then you do think about ending it. I see Allison just joined. Do you want to add anything?
Not at this time, because I don't know what you're talking about.
We're talking about the purpose of the health count. So understanding, do we want to disband our merry troop and go a different direction? Or do we want to enhance what we're trying to do and make it more of an effective group with some things? And Mark's given one side of it, and there's been some others, like giving their input as well.
So the grand majority of this is a policy issue. I'm not going to take a side if, I do see from being a good steward of taxpayer dollars, paying for the meetings and the per diems and that kind of stuff that people may get with the meetings, if there really is no true purpose. I do think that you have to think about that. But ultimately, if you want to cut ties now or cut ties at some other time, that's generally up to you guys. But did you guys get my memorandum that?
Yes. Yeah.
So really everything is kind of an advisory role. So it's really kind of, I know that there's been a huge initiative about cutting out red tape and kind of reducing bureaucracy and that kind of thing. And so it's just, is there really kind of a purpose here? But ultimately that's up to you guys. You guys have to decide how you want it functionally, if you're comfortable with that. Right now, you're still in the century code, but it's ultimately, do you think that you serve enough of a purpose to continue on that? Or like you guys discussed at the last meeting, did you want to shift to more of a public policy or public health initiatives role? Kind of where do you see that going? Which I'm sure you guys have been talking about, but most of those are policy decisions.
Thanks, Allison. So what direction does the group want to go? You want to think about it, but if you want to change it for legislation, we kind of need to decide that pretty soon.
So one additional thought as Allison was talking is, during COVID, I think one of the things that we realized, there was an opportunity for us to have, for lack of a better term, given the Department of Health and the governor a little more covered. However, the fact that it had to be an open meeting and, the notice requirements make it very difficult to be responsive in a time like that. And so, I think in the past when, the pace of information wasn't, everybody expects an answer instantaneously. I think you would have, even in a pandemic time, but in a time when people didn't expect instant information, there would have been time for the Health Council to kind of be able to come in and say, okay, let's vote on these things. And then now it's not just this, person making a unilateral decision, but I think just the reality of the world that we live in today, it's very hard for us to be responsive in times of emergency. I think there is opportunity when there's some bigger overarching things, but I also, now with the new DHHS, is there, even if we wanted to help create kind of a vision for the future, they don't really have to listen to us because State Health Council isn't over that, so I guess I'm really struggling to find, like, Mark, I want to envision that future that you have, but I'm really struggling to figure out what that would actually mean and how we could justify whatever it is, $60 times each one of us or whatever it is, for us to, continue while we're not really sure what we're helping.
Mark?
Well, I'm saving you money because I can't get paid since I work for NDSU, so there's $60 less per meeting. What
And
happened?
I'm free as well, so.
What happened? So I came on after the kind of reorganization 2 years ago. I mean, what was the problem prior that the legislature thought that they were solving by making the State Health Council more of an advisory capacity? Who can help me with understanding what was the problem that they were addressing by that? If anybody,
I don't know that there was anybody who thought that the State Health Council was over their skis or anything like that, and they were trying to pare it back. It was that even then we didn't know what purpose we were serving. So they were actually making the law match what we were doing at that time. Because it was saying that we needed to do 100 different things that we weren't actually doing. So then we made the law match reality. Was my gut feel on that. Dirk, would you, or Dr. Weedy, you were kind of walking in brand new and blind that day.
Yeah, well, and I would agree with what you're saying, Kirsten. And I think there's also kind of sort of the new structure as well as before it was the Department of Health as just the Department of Health and the Health Council. Now it's HHS, State Health Officer, Executive Director of, so there's a lot of different governing roles and responsibilities that it gets confusing. I'll just be honest, even in my role, it gets confusing of where to go, when to go, how to go, and then the timeliness of that, of how do you handle all that to make sure you're following the code as instructed.
I'm new to this, only 2 years in, and given that we're coming out of a pandemic and given that we're only now beginning to try and operationalize the new wording in the Century Code about our responsibility, I'd like for us to give it another shot and take more time doing that visioning. And maybe 2 years from now, we acknowledge it's just not working. So the DHHS is new, so that's new. So I don't think this is the time to propose shutting down in the face of, we're in a unique time because of COVID. It had been changed in Century Code. We do have a DHHS, so it's a complicated set of relationships. So I want to be a part of a council that's either proactive and saying, let's serve our people and let's carry out our responsibilities conscientiously. And if it doesn't seem to make a difference, and if we're spinning our wheels, then shut down. But I'm concerned that we're facing a bunch of variables now that we could be shutting down for the wrong reasons. And all these other factors are all in play. And I wouldn't want those factors, the COVID trump card and all this other stuff. So I guess I'm willing to trudge along for 2 more years, but not on business as usual mode. I'm willing to trudge along on 2 more years if we have meetings like we're having today, where we talk candidly, respectfully, openly, trusting, I'm a big fan of Covey's speed of trust. If we trust each other, we can change the world. If we can speak honestly and openly, we can change the world because, that trust is where it's at. And I'm very much appreciative of seeing our council developing trust by having to make decisions and have conversations. So personally, it means the world to me how you all engage. And I'm thankful for that. And I think if we have that, then we can perhaps answer this question well. And maybe a year or 2 from now, we'll have a better answer that, okay, we were actually dreaming and it's spinning our wheels, because I don't want bureaucracy and I don't want to just rubber stamp. But I have felt in my time on here, we've had meaningful conversations and I just feel like the health of our state and the transition we're in right now, it can't be overstated how important it is. And I welcome the opportunity to be at the table in a formal capacity to try and serve that greater interest. So my recommendation would be that now isn't the time to make a decision to disband. Now is the time to ask, how do we operationalize what we're asked to do in Century Code? And then after 2 years, see if it means anything. And if it doesn't, then call it quits.
Thank you, Mark. I'm kind of on the same page as you. How about others that are on the council? Do you have a preference? Daryl, Mary, Carrie, Kristen, Daryl?
I agree with Mark and Sherry that I guess, my idea of coming on to the Health Council was, to make a difference and to discuss things that need to be done. And I feel like so far all we've done is do loan repayment stuff, but I think if there's a new role for us that we can go forward, I would enjoy to be a part of it.
Thanks, Carrie. Daryl?
I certainly agree with all of the comments that were made, first of all by Mark and then by Sherry and then by Dr. Random. I totally support that. Let's just figure out how we can do that and then start the process moving forward.
Kristen, you have any other thoughts? And Mary?
Nothing I haven't already said.
Okay, thanks.
So this is Allison. I do just kind of want to clarify here. So under the current statutory schematic, you guys have very specific powers and duties. You can't, without some type of statutory change, just completely change how you function and what you're able to do. Like, you can't make that decision on your own. And so what you're talking about doing would need to be a legislative change, because you don't have the authority to just decide we're going to do something different under the current statutory framework and decide that we're going to kind of be this health think tank. So if that's the idea that you want to go, I just kind of procedurally want you guys to understand that that is something that you are going to have to pose to the legislature, and the legislature has to accept that.
Thanks, Allison. Daryl, you had your hand up?
So earlier on, before Allison, before you were on, Mark read some verbiage out of the Century Code that defined that there are things that we could be doing that we're not doing. So my hope would be that you would help us interpret and understand that so that we can move forward in what the council wants to do.
Mark, do you want to read that section? You're on mute.
Sorry about that. I'll share my screen. It's easier to just let the words speak for themselves. So this is part of the rules of the State Health Council that were not, that are sort of the prelude to it. So the terms, the most important part, being here, the powers and duties of the Health Council. So establish standards and regulations which are found necessary. And Allison, we exchanged an email through Dr. Wiebe about this. So, and I think in the email you said something along the lines, are you guys seeing this, by the way?
Yes.
Yes.
Okay, thank you. Something along the lines that establish is a little bit flexible, but at a minimum, it means that we can put forward ideas. They may or may not be received, but I think it allows us to have a potential role in standards, putting forward. I don't know what establish means here. I don't know what that means besides something significant. It doesn't say recommend or discuss. Standards and regulations which are found necessary for the maintenance of public health, including sanitation and disease control. So that's one responsibility that I think bears taking note of. A second is holding hearings on all matters. So we're meant to be the place that the public can ask us to hold a hearing if they're concerned about too much spraying of mosquitoes or, some pollution.
Nope. You got to read the whole sentence here. It's of medical hospitals. That's
okay.
it.
All right. Thank you for the correction. And then the last statement is the council may direct the state health officer to do or to cause to be done any or all of the things which may be required in the proper performance of the various duties placed upon the Department of Health and Human Services. So this suggests an important relationship with the state health officer. And it doesn't specify specific responsibilities. So those are two things that I saw in terms of duties that are beyond the ones that are below, which most of which are kind of rubber stamping requests for funding for loan repayment programs. So that's what I was referring to. Is that what you were asking about, Sherry or Daryl?
Yes, that's what we were talking about ahead of time, and that's what Daryl was referencing to, Allison. So are we interpreting that wrong?
No, you certainly can. I thought you were talking about being more of kind of a policy think tank for the direction of the public health division of
No,
NDHHS. See, there's some definite cons for coming in right in the middle of a meeting. So.
but it's good that there's clarity as well. Like
Yes.
that makes no sense. And that's why we bring it
No,
up.
you guys have the current powers and duties that you currently have. Now, I just want to specify that unless you guys change something, you will still have to be the rubber stamper of the dollars for the loan repayment programs and stuff. Like that's still on the table. Of course, if you don't want to do that anymore, if you feel like that's not a good use of your time, then we can do a legislative change to shift that back to the public health division. But ultimately, that is one of the powers that you have, is you can talk about those standards and regulations. Yes.
So what are you guys' thoughts going forward? Leave things as they are, switch things around, wait and see what happens, have another meeting and now everybody's quiet.
I'll be the wet blanket. I still would lean towards disbanding.
Others? Okay. If you want to disband, then that would be a motion. If there's nothing else that wants to happen, that would not be a motion. So which direction do you want to go?
Well, I'll make a motion and then it can die for lack of a second or get voted against, whatever we end up with. But I'll make a motion to propose legislation to remove all reference to the State Health Council and disband the meeting, disband the council.
Thank you, Kristen. Is there a second? Is there a second? Okay, Allison, I don't need to do anything else, do I?
Nope, dies for lack of a second.
Okay, thank you. All right, thank you. Dr. Wiebe.
Yeah, I'll just kind of like, I think it was mentioned a few times, for administrative purposes and some maybe to kind of facilitate the work of the loan repayment program. And if the State Health Council perceives this as more of a kind of a rubber stamp, or that it might not be the best use of their time, then there might be a possibility or kind of like consideration to piecing this out and making the necessary changes so then it goes back. So then Kelly, Kaylee, and Dirk within the Division of Public Health have the agility and the ability to oversee the program without the need of a rubber stamping from the State Health Council. So that might also be something to consider.
Would that affect the bill to add public health if we move that over? Shouldn't, I'm guessing, because they're two separate things, but.
They are two separate. So the other one would be a bill to add an additional category, while if the State Health Council chooses to maybe carve out the loan repayment program administration, then that will require some kind of legislative, I would call it cleanup or adjustment, so then it refers back to the department.
So what are you guys' feelings on that part, to return the loan repayment part back to, or not, I don't know if it's been back, but return it to the health department, or just leave it as is as part of this looking forward over the next 2 years? So what are your thoughts on that part? Because that would take legislative intent. Mark?
Is there a reason that the loan repayment program was in the State Health Council from the perspective of being, a governor appointed council, so that we're public, we're open, that conflicts of interest or other issues would be more easily managed? And then is there any, if it was to put it, back to the State Health Department, at the end of the day, who's making the decision? Which body is making the decision? How are those decision makers chosen? I guess I'm always concerned about when scholarship monies are approved, those have to be, very transparent, fair decisions. So I'm not questioning whether it would be more fair or more open, but I'm just wondering if that's why it was at the Health Council, and then how that would be managed if it was put into the Health Department.
I would have to pull the legislative history for some of those loan repayment programs. A lot of the issues that you're talking about are true, and they are considered, and the geographic diversity, because there is a geographic component of a lot of the loan repayments and shortage is in certain areas. If the State Health Council were not to approve these, they would be handled internally by Dirk and ultimately Chris Jones.
Given the way in which we handle scholarships here at the university, which is millions of dollars of scholarships, and the process by which it happens, I think I would like to know that it's something that's more of a kind of a neutral, established public body who's making those decisions than to just think it's at the desk of the DHHS executive director.
So your suggestion is just to leave it as this component as well?
I'm just asking. I'm happy to be rid of the bureaucracy, but I'm strongly concerned about conflict of interest and not having things be publicly accessible to all, open and equally accessible.
Sherry, if I could make a couple of comments. My thoughts as well were, if we as a council were just going to do the loan repayment approval, then that's, I think, when from my perspective, that might as well be done by someone else. But if we're going to continue to function as a body, that could certainly be one of the roles that we continue to play and be that quote unquote neutral body to do some of that work. But I would also like to have some direction from Dr. Wiebe, Dirk, Allison, Sherry, you, because you like to give orders, but how we might move forward to actually get down with some of the busy work about what else can we do and how can we do it.
Dr. Wiebe or Dirk, you want to start? Because I'm giving you orders.
Yeah, well, so one thing that is, we have language in the Century Code, and that would be the guide for the State Health Council. It would be kind of doing things backwards if we are trying to find something so then the State Health Council can do. So at least whatever is in the Century Code, that would be the guideline of the duties or the authority of the State Health Council.
So I guess I'll clarify the question just to say, do we as a council have to formally meet and then send out notice and that's how we start working? Or can there be a subgroup of people that would work with Dr. Wiebe and develop something to bring forward to the council? What can the process be?
So the process is kind of one of two things. So you guys can meet and discuss. If there is a quorum of the State Health Council, then it would have to be noticed as a State Health Council meeting. You can make a committee that talks about maybe, I don't know, are there standards necessary for the maintenance of public health, including sanitation and disease control, that aren't already addressed that you guys want to touch base on, you can have a committee that does that. That committee, though, would then have to be noticed as an open meeting. The only way that you get around noticing things is if you have one person do it. That's the only way. And I don't know if leaving the entire directionality of this whole group up to one person is really what you want to do. That person would have a lot of authority, is kind of what I'm saying.
Yeah, I don't think that's the idea. I think as we go forward and part of this group and working with Dr. Wiebe, and the non-voting, non-capacity thing would be to address some of those things that are going to be on the plate for making North Dakota the healthiest thing. And how does that, are there any standards in that that we can address? So I think it can be, I guess is that kind of the vision you were thinking, Mark? Something like that as well?
Well, the last item in terms of our relationship with the state health officer, is one aspect. So, if there was a committee formed, maybe it would be a committee to have a couple of meetings to meet with Dr. Wiebe, Chris Jones, to clarify what that actually means. What does that actually look like? An ad hoc, short duration, to put some teeth to it. I don't think just sitting and talking, among our own health council members indefinitely is going to accomplish a lot, because what we do has to be linked well with the state health officer, with the DHHS. And if those conversations are suggestive that we're not needed, they have no idea of what we would do, if we were to put something forward, what would it mean to them? That would answer the question, and that would also be informative in my mind. So I'm not trying to create anything. I'm trying to ask the question. We've been given a task. How do we do it with due diligence and conscientiousness? And then if we give it the old college try, we just allow the reality to kind of inform what we should be doing. So I don't have any specific task to play. But I do know there was lots of conversation during COVID about where's the health council? They're gone. They're non-existent. That, was part of my motivation to accept the invitation to be on the council. Was I thought that was a sad statement in our state when we're in an emergency, and a governor-appointed council is not heard from, is not recognized, is not acting. And I'm not saying anything about anybody on this council. I mean, I have no idea why that was or how it happened, but I was asked by many people what their role would be or should be. I didn't have any answer. So that, I guess, I don't have any specific request or plan, but I'm of the mind that if I'm doing something, I want to do it conscientiously and openly and collaboratively. And if that isn't going to happen, then we're not really accomplishing anything.
So in lieu of time, I have a suggestion. It kind of goes with number 3, meeting frequency. My vision initially was to meet quarterly and at least to get things going. I don't know if quarterly is a cost-effective measure, but I think initially we need to meet to figure out next steps, and then if we get no next steps, we can extend the meetings later, I guess, and that will give us our answer as well. But what do others think? I mean, I hate to just say we're done today, we got this part going, we're not going to meet for 6 months. You know what I mean? I think we at least have to have a meeting in the interim to figure out, are we going to have a subcommittee? Are we going to, what are the next steps? So, what are your thoughts on that?
I think I've used up my quota of talking sticks. I think I've used up my quota of talking sticks. I hope others might have some thoughts on this as well.
Okay, let's do this. Does anybody disagree? We have a meeting within the next 3 months to figure out the agenda for next steps. Kristen, were you going to say something?
I have to leave right now, so I just
Okay.
didn't make sure you didn't need my vote for something for quorum.
Okay. I don't know if we're going to actually vote on anything else, but thank you so much for all your input. I really appreciate it.
Thank you, guys.
Sherry, I think as well that we should meet to specifically talk about the additional work that we could be and can be and should be doing. Because as was mentioned earlier, during the pandemic, there were a lot of folks, including legislators, who reached out to us to say, what are you guys doing, or et cetera. But if we could meet and start working on putting together some of the other work that we think are important to North Dakota, then that would be helpful.
Carrie, Mary,
I
Any
would
dis-
agree. I think that, having a meeting sooner than waiting for 6 months, nothing's going to happen. And then we're just going to end up, not doing anything. So.
thank you. Mary, do you have any disagreement with that?
I agree with Carrie.
Okay, thank you guys. Okay, I will work with Miranda and Dr. Wiebe and then get something on the calendar as soon as possible so you can get it on your calendars, something within the next couple months or so, and try to get, and then we can set up the next meetings to be a little bit more regular, but we'll try to do that as soon as we can for next steps. In the interim, your assignment is either make a phone call or something to come up with next ideas in your head, what you think that Century Code sounds like, so that it can be a little bit of a working meeting as well. Any disagreement on that?
No disagreement, but whether it's Mark or Allison, can you send us that statute that defines all that, just for ease of us having that information, please?
Thank you. Or Mark, or you guys could send it to Miranda and she can send it out to the group as well. Dr. Wiebe, I know you had a meeting. Do you want to do your real fast update?
Yeah, it's, there hasn't been much change since last meeting, since the last update. We are still kind of unwinding COVID. There has been a lot of work related to respiratory diseases, flu, RSV, cold, TB, you name it. There is always stuff that keeps our public health team busy. And we have been busy with the budget season and in preparation for the legislative session in January. So our team is always busy, and when, as Mark said, they are not thanked enough. So I take every opportunity to express my gratitude and thanks to our team and all the work that they've been doing for several years, and especially in the last 3 years. So that's my update, and I'll be open for any questions.
Thank you, Dr. Wiebe. I think this is an exciting time for public health in general. And I mean exciting in the chance that we've had a tough couple years and been beat up quite a bit, but we have an opportunity to either try to go forward with a positive attitude or just kick the can backwards. And so I think we need to try to do what we can, and whatever that looks like will yet to be determined. So does somebody want to make a motion to adjourn?
So done.
Thank you. Is there a second?
I second.
And if I got this right, Miranda, can you take a roll call on that?
Actually, it can just be a voice vote, correct, Allison?
Okay. All in favor of adjourning, say aye.
Aye.
I
Anybody opposed? Thank you, guys, and thank you for all your hard work. And hopefully next steps will be coming together and working to enhance public health. Thank you, guys.
Hi, everyone.
think